Hey Carol, you have that nice unicorn or whatever it is.
Yes, good afternoon.
Yeah.
How are you today?
I'm feeling very good. So you have that dragon, unicorn, whatever it is, very flashy and
Yeah.
nice. Hi Tina. Let's wait for some time for people to join in.
Good afternoon, ma'am.
Good afternoon. Good afternoon. Hi Lakshmi ma'am. Hello Ruby ma'am. Some issues joining?
Good afternoon, ma'am.
Good afternoon. Hey Alpa, hi.
Hi, how are you?
How have you been?
Good, good, good. Good afternoon, ma'am.
Good afternoon ma'am. So today's class is just a single class, one turn. Now from tomorrow onwards, I'm not there for 10 days. So that's why I put a very short, small topic, heel pain, which gets over in one day. So it's just part one. From tomorrow, I won't be there. Then I will join from 4th of November. Should we get started or wait till we are 10? We are a number of 10. We'll just wait for one more person to join. There, we are number of 10 now. Okay, we'll start. So welcome everybody to this class on understanding heel pain. It is just part one, a small, brief, but very common complaint. So we will see what justice we can be doing to understanding of heel pain. So this again is my favorite slide. Knowledge is power, information is ammunition, and awareness is enlightenment. The ancient maxim, know thyself, applies to every aspect of human existence, especially to one's health. The prevention, treatment, and management of illness and disease becomes easier and more effective when we are aware of the early symptoms of a medical condition, how to recognize those symptoms, and then how to go about getting the right kind of treatment. What do we mean by this, and why the hell is it my favorite slide? So we have been attending these medical camps since the past 3 years. We've learned a lot from these camps, but these camps are not so that we can take the domain of self-diagnosis, self-medication, self-investigation, self-treatment. No, we need to consult a doctor, let him do the diagnosis, let him suggest some investigation, let him suggest maybe a senior doctor, okay, to deal with your complaint or illness or any kind of indisposition. It is not prudent to be doing things ourselves, but these camps are just for your awareness so that you can be, from learning the signs and symptoms, you can be picking up your disease in the initial stages, wherein it is easy to nip it in the bud stage. It does not snowball and become like a snowball effect, a bigger last stage of the disease. So these camps are just to update you about what's happening and how to recognize the early symptoms of a disease in your body. And my aim is to get things easier for all, but do not take this whole management part on yourself. Consult a doctor. Okay. So heel pain can be due to causes having underlying disease. What do you mean by this? So heel pain is not a disease by itself. It is a concomitant or a symptom of something else happening in your body. So something else can be some minor disease in your body. Along with that, what is a concomitant? Anybody can tell me the meaning of a concomitant? It's an English word. It's not a medical word. What is the meaning of a concomitant?
Something that's happening caused by something else. So it's together.
Together. So you are right in this together, but it may not be caused by something else, Carol. So suppose I have fever. Along with fever, I will have malaise and body pains, right? So this is concomitant, is another symptom which is happening simultaneously existing with the major disease or major disorder, okay, along with it, concomitant. So heel pain is not a disease. It can be a concomitant to some major other illness which you're suffering from, and maybe the body is not able to metabolize the calcium which we are taking, and then it is a sequelae to that. We'll study how it happens. So this is the meaning that heel pain can be due to causes having underlying disease. Example include poorly fitting shoes. What is the meaning of poorly fitting shoes? So we get some very expensive pair of shoes and we do not want to, sometimes we call for shoes, online, and they don't fit us well. And we think, let me just put some insole or let me wear socks underneath and all. But then at that same area, the shoe keeps pricking. Do you know the beauty of shoes? What is the beauty of shoes? That your shoe may not prick me in the same place. Right? That's the beauty of shoes. So that's why they say wearer knows where the shoe bites. There's a saying. We all know the common saying that my shoe, you should be going into my shoes to understand my problem. We have heard a very common line. Okay? Go into somebody else's shoes to understand the pain that they are going through. But the more deeper proverb is what? That wearer knows where the shoe bites, because your shoe is going to prick you in that place only, because your shoe, your place. Okay, suppose I wear Alpa's shoe, that will not prick me, maybe it's very big for me, right? So wearer knows where the shoe bites. So now suppose you're continuing to wear that, if it is causing friction in that particular area, you may get a bunion, you may get some another malalignment of the shoe, and then it can be a referred pain showing the heel pain. Wearing high heel shoes, what do you mean by these two things? These two things lead to the same thing: standing for long hours, wearing high heel shoes. What do they mean? Why can they give me heel pain? What happens when I wear high heel shoes, stilettos, and what happens when I'm standing for long hours? Tell me. Then if you all understand it well, you can understand it well.
We are
It's put-
standing more on toes and not using our heel. Our heel is up, it's going up.
Okay. Something else happens.
It changes the pressure on our feet and the physics, our position on the body. It's like I don't know how do you call it. It has like a snowball effect. One thing affects another part of the body.
Yes, you're right, Carol. But then what changes occur in the
Posture.
posture, in the spine, to be specific? If you all cannot give me the right answer, after some time I will give you all one clue and then you'll immediately get the answer. Something happens when I stand for long hours, and something happens when I am wearing high heel shoes for long periods of time.
Center
Calf
of
muscles and
gravity.
thigh pain.
Hmm?
Calf muscles and thigh pain.
Calf muscles and thigh pain, but I'm asking you the question of what happens to your spine.
Spine. Okay.
The center of gravity changes.
Center of gravity changes. So can you be more elaborate with that answer?
It has to do with physics.
No.
More pressure on it. There's more pressure.
No.
Back pain.
Yes, but because of what, Sureka Kamath? Back pain because of what? What happens that
Because
causes
the spine is hanging. No, means like
that?
it
No,
doesn't have a support.
Heel is taking all the pressure.
no. Okay, I give you the clue. What happens when you're standing for long? You know why I trouble you all like this?
So we remember.
I trouble you all, no?
No, so that
No,
we
you
remember.
question us.
Yes, so that you remember the answer well. It's taking each one of your time to scratch those gray cells out, and then you'll remember the answer very well. Okay, if you get things on a platter, you don't revalue it, no? Okay, so I'm putting in the third reason also. Let me see किसमें दिमाग का बत्ती Mentos जलता है. So it is what happens when you stand for long hours, what happens when you're wearing stilettos, high heels, and what happens when you are pregnant.
Pressure on the back.
अरे,
The-
वो
The
Sir.
curve of your back
It
changes.
curves, yeah. The spine curves or lordosis or something like that. You know, like,
curves where? Shubhangi Tirokar. Spine curves where? Which direction?
Front.
To the front.
Yes, and then what happens?
Then
I
the
don't
posture.
want the medical word. Give me a simple word. What happens when you're pregnant? Baby goes on increasing in size. What does the baby do?
you tend to turn backwards, like to
It
balance.
takes pressure.
Kick you.
Okay, the baby
Pressure.
is growing this way in front. The baby is growing front. Mini ho gaya. What happens to the back curvature, my dear friends, my dear seniors?
You bend forward.
Going back. Backward.
Lordosis.
So we have a newcomer, Alpana madam. Welcome. So what happens is that the baby is growing this way. It's pulling the spinal muscles forward and the arch of the lumbar, which is known as lordosis, the natural lordosis of the lumbar spine. We have a second natural lordosis in the cervical region. That curve gets exaggerated, or the curve gets increased, or the curve becomes more curvier. Because standing long hours, you will protrude your belly forward. When you are wearing heels, you will protrude your belly forward. The same thing happens when the lady is pregnant. Spinal muscles are put forward, and that excessive lordosis creates pain. Back pain also. And obviously, if the back is being pulled, the muscles are pulled forward, the buttocks are pulled upwards, the spine, the hamstrings, the back thigh muscles are also getting tight, and maybe the person complains of knee pain also, just because of that exaggerated lumbar curve, the lordosis. So suppose you have to stand for long hours. It is inevitable. You can't run away. You're in a queue. You're in the airport line. If you leave your space will be gone. Your number will be gone. So you can be what? Learning to do the cat and the cow while standing. Get to hoots about who's looking at you. So you do a standing cat and a cow. If you're seated, do a cat and a cow. What happens when you do a cat and a cow?
The spine stretches.
How? Give me a good answer. Mogambo ko push karo.
Backward,
Mogambo
forward.
कभी कुछ नहीं कर
Backward,
सकेंगे.
forward mein what happens? So Alpa, this is yoga therapy. Think. What
It
happens?
probably comes into the right position.
Exactly, Nikki Masaya. So you're doing a Shah Rukh Khan ka mitwa like this. A mitwa. He does this no mitwa. Okay. And then you do this. Or it's called as the happy cow and the angry cow. Okay. So you're going to the extreme of the front. You're going to the extreme of the back. And when there is an alternate action of 2-3 times you've done it, 5 rounds you've done it, back and forth, when the darling spine comes and rests, that is, yes, that is the actual resting stage of your spine. Anybody wants me to repeat? Yeah, Lakshmi madam, bouncer. Lakshmi madam comes religiously for my classes. Did you follow Murshana madam what I'm saying?
Yeah, I followed, but that Shahrukh Khan का जो posture है ऐसा, he does like this, and what to do, you just show there.
What to do? No, प्यार किया नहीं जाता, प्यार हो जाता है. Spine को correct करना नहीं है, spine correct हो जाएगा. So all of you all come start doing. Now you all are seated. Come on, do the going back. Stretch your hands seated में. Let the belly protrude forward. Extend, extend like a big-hearted man. Come on, shoulders going back. Chest expands. Hey, Dilip sir, more. Belly protruding out. Chest protruding out. Yes, Rita madam. And now exhale and hug yourself. So like this. Exhale and hug yourself. Create that arch. Don't tighten your neck region, Dilip sir. Like this. Neck has to be ruled. Otherwise, one pay, one free. You're doing back release, neck tight. One pay, one free. Come on. Inhale. Go back. Drop your head back. And exhale. Sikudlo. If you can do Pawan Muktasan with your legs, it's a cherry on the cake. Come on, come on. Last third round. Inhale and exhale. Protrude the back out. Fourth round. Inhale. Head back. Exhale. Chin to the notch in exhaling. Last round. Inhale. Protrude the spine forward. Exhale. And now release. Murshana madam.
Yes, I understood.
It's done. Okay? It's done.
Yeah.
So I don't have a microscope or a thing to measure if it's right angle or no, but it's right angle to my body.
Yes.
Hello, Sid.
Understood.
Makasa, welcome. Newcomer. Followed what you all did? Okay. any kind of mal-alignment in the spine you corrected just by this cat and cow seated. Is it that I'm asking you too much to do in the whole day? Tasneem Pital wala, in the whole day, if you just do this, Shashi Makijani, is it too much to do? Certainly not. What are you doing? You're releasing any kind of improper posture of that spine, and because you're doing that, the muscles, yes, very doable, exactly, and the muscles next to the spine, you've exercised those also, you contracted and released those also. Making sense? Yes, no, perhaps?
Yes.
Okay, Sampanna madam पण आले आहे. Yes, so what do you mean by sprains and strains or trauma? Haven't you seen when you are walking on the footpath, many youngsters, many seniors, they have ankle sprains. Suddenly the ankle gets sprained and they'll tell you, "Arey, my ankle is very prone to getting sprained." Why does that sprain happen? My daughter also.
Balance, losing balance.
No, it's not the question of balance. They are young.
Inattentive, so the
Inattentive to everybody is, because we have something else when we are walking also. Everybody is inattentive.
Strength in the muscles is less.
Ah, Nikki?
Muscle strength is less also. So
Exactly. The ankles muscles are weak. So there are specific exercises for strengthening your muscles of the ankle with resistance. A simple thing like this is my foot, this is the hand. So you must tell somebody else to do this for you. Ask somebody to place a hand. This is your foot, this is the other person's hand, this is your foot, and ask him pressure. So you will be applying pressure and that person will prevent you from taking your foot forward. Right? Opposite to that, another exercise, the person's hand will be here. You will be flexing your ankles against that person's hand with pressure. You are going to strengthen the muscles of the ankle. So this has to be like 10 counts this way. This is ankle extension with resistance and ankle flexion with resistance. You can't do it yourself because you can't apply that much pressure. And once you reach your feet, you're not all that comfortable. But in case you don't get somebody, might as well do it yourself.
you can do against the wall.
Hmm?
Against the wall, can we do it?
How can you do it against the wall? You can be doing only extension then.
Okay.
You can't be doing flexion. How will the wall come in between?
Yeah.
How will you do flexion? You can do only extension. But might as well do extension. Okay? But all this you must be holding for 10 counts to develop that strength in your ankles for you to prevent ankle sprains, or this is also known as a misstep. Clear? Very important to do resistance exercises with your ankles to develop that strength. Suppose you don't have anything, then you can take a yoga belt, not a TheraBand, because that stretches. You can be lying down and doing toes in, toes out, toes in, toes out with a yoga belt. But you need some amount of resistance, because if you will just plain put your foot up and down, it will not offer that resistance. Yes,
ma'am, if we do it lying on the bed, do we need to put a pillow below the knees?
that is knee strength. No, I'm talking of ankles.
No, but I mean, even just the basic, if we do we need to put a
You
pillow?
can be doing it standing on the wall also. Keep a pillow. I taught in one class. Take 2 small cushions. Try to push the cushion against the wall with the back of your knees. I taught in one class.
Okay. I don't attend your Friday session, no?
You didn't attend. I taught maybe a month back.
No, it was in mornings is not possible.
Wall exercises for seniors, and I taught knee pain in that whole wall exercises.
Okay.
So this is something which we have to understand today. Plantar fasciitis. So plantar is what? Plantar is the sole of your foot, and this is known as palmar, and the sole of the foot is known as plantar. The fascia gets tightened. I will explain to you. And Achilles is the tendon, that curve of the foot we have above the heel, that is known as the tendo-Achilles. Okay, Achilles tendon are most common causes. So there's a proverb also that this is my Achilles. What is the meaning of? You can Google what's the proverb. It means that this is my weak point. I have an Achilles. Okay, it's known as a weak point. Maybe it comes from some proverb that this was the most weak area of the person and the person was killed or something like that. You can Google the whole story. One patient of mine told me and I couldn't understand the meaning, so I had to ask her. I had to Google. I didn't ask her. Heel pain has a typical morning aggravation. Now this, everybody of y'all will be vouching and saying, yes ma'am, heel pain is typical morning aggravation, because as we step up in the morning, it is so excruciating pain that I'm not able to keep the foot also on the floor. I will explain again why. And I will also explain what to do for as a remedy for that. Foot stretches and ball exercises help to loosen the tight fascia. So what happens is, as we are sleeping, even whether it is rheumatoid arthritis, even if it is osteoarthritis, even if it is any kind of pain in your body, there will always be a morning aggravation. Morning mein bahut darad hota hai. And as I walk up, the joints get loose, the joints get freed up, and the pain decreases. So this is known as initial motion aggravates, but continued motion ameliorates. So the rheumatoid arthritis, also small joint people, small joint pain people in the digits, it starts of the fingers. After some time, they will tell you, I did this movement, I did all this, and मेरा pain ठीक हो गया. जैसे जैसे काम करना शुरू कर दिया. The issue is that the whole body. What is fascia? Let me explain to you. What is fascia of the body? Come try.
Skin.
No, skin is skin. Fascia is not skin. When guests come to your house and you're cutting fruits, because you will not get time. I know it's not a good idea to cut fruits and keep, but you made fruit custard, okay, fruit salad, and then you want to keep it in the fridge. What do? Don't you cover it with something? That nice bowl, you cover it with something, no? Because that malai will.
Yeah,
So what is that covering called? It's known as that cling film. Cling film.
yeah.
Intact.
Tissue surrounding the organs.
Okay, so I thought you will cover the bowl with tissues.
I mean the fascia's meaning I told ma'am.
The fascia is that not a tissue, because tissues are not transparent, madam. Tissues, a cell, a collection of cells is a tissue. A collection of tissues is an organ or a viscera. I'll repeat. A collection of cells is tissue, and collection of tissues is a viscera or an organ. Okay, so they are not transparent. So now your heart has a covering which is known as pericardium. Your lungs have a covering which is known as a pleura. Your stomach has a covering which is known as an omentum. So every different place there's a covering, and then there means the organs are enveloped in that transparent cling film by God, and then the whole body is also again as a safety mechanism having a fascia. So in people who are less mobile, also in people who are very anxious and very hyperactive, you will see that their fascias are very tight. That's the reason they cannot relax. It's very difficult for people to follow a yoga nidra. The people who are constantly thinking, anxiety personality, the phobia personalities, a lot of heart rate increase, tachycardia, they have very tight fascias. They cannot relax even if the person is telling you, the doctor will tell you, relax, relax, breathe. They are not able to relax. Okay, so this fascia also, it's a good idea. That's why to be completely moving. Why I tell you, moving in medicine, movement is medicine, motion is lotion. Okay, keep moving. They say no. What is that in Hindi? Harkat mein hi barkat hai. What is the meaning of harkat? Do some movement, do some harkate. Harkat mein hi barkat hai. Okay, why? Because that will loosen up your fascia, which gets tight throughout the night. There is no movement in the body. that fascia gets tight. So it's a good idea to be moving. And that's why the pain decreases as you move. Okay, if you're suffering from generalized aches and pain, stiff ankles and heel pain in the morning, you come for yoga therapy for ailments, this is the right class. Okay, now let us understand the heel anatomy. So, what causes heel pain? So, it's not always plantar fasciitis. So, what is the meaning of plantar? Plantar is the sole of the foot. The sole of the foot, that intact film or the cling film, that is the fascia, gets tightened, and that's why we complain of heel pain. Then this tendon is what? Tendon is the white fibrous tissue. The bone does not attach directly to the muscle, does not attach directly to the bone. Muscle is red in color. The tendon is white fibrous tissue that gets inflamed. Okay, that gets inflamed. So the Achilles tendonitis. Okay, if this gets inflamed, then also you will complain of heel pain. And like we complain of carpal tunnel syndrome, the small bones are known as carpal in the hand, and the small bones, hello Kulwant Dhawan, welcome newcomer, and the small bones of your foot are known as tarsals. So here they are in a tunnel, so it's known as carpal tunnel syndrome in the hand, and in the foot it's known as tarsal tunnel syndrome. That can also lead to heel pain. So heel pain is not just a spur, or it can be stress fractures which happen in people who are osteoporotic and who are overweight. Okay, overweight people can be just getting this stress fracture if they are not able to manage their weight. And heel pad bruise. What is the meaning of bruise? Is a tear kind of thing. That pad which we have on the heel somehow gets reduced, and you get a lot of heel pad bruise. So these are the reasons for heel pain. So what is Achilles tendon? So this is the two bones we have below the knee, tibia and fibula. Talus. These are the small bones. They are known as talus, navicular kidney. Each one has a nice name. Phalanges are the toes. And this white fascia has become tightened. And so obviously in this bone, this is the calcaneus, which is the heel bone. This gets pain. Okay. So what is Achilles tendonitis? Is irritated and inflamed this tendon. Can you see this red circle? Okay, irritated and inflamed Achilles tendon, which will lead to again heel pain. This calcaneum bone. That's why it's known as calcanean spur. What's a calcanean spur? So the spur can come in any bone. Anybody can tell me why they occur?
Because calcium is not absorbed properly.
Calcium is not absorbed. Improper mobilization also of the calcium. So what does the body respond by? By forming these porcupine-like adhesions. Okay, they are also known as Vicky
Osteophytes.
osteophytes.
Osteophyte.
Yes, and again when we keep moving, those osteophytes break up and they are put into circulation. That's why sometimes if they are there in your spine and they are pressing the nerve, that's why we get a nerve compression below it. Then also you can get pain. But keep moving that spine, keep moving. Okay? Now, by moving, I do not say that do it in a torture mode. What's the meaning of torture mode? You're getting pain, but Divya ma'am has said you do it. No, do as per you are comfortable. There are people who just relax when they are unwell. They don't do anything. Please understand that time also you should be moving according to your capacity. Right? So the proverb which applies to me is I say if I will rest, I will rust. But rest is needed, but not all the time.
Someone's television is.
Some background noise from your side. So this is exactly the explanation of plantar fasciitis. That's why I'm going to recommend a nice exercise for this. See, it comes from all the 5 toes. See, can you see the 3 toes? And then you off, or they will, why they have shown redness? Because the fascia is inflamed. Tina, can you just see whose mic is being fluent? Yeah, thank you for that. No, it's not gone.
No, it's going on.
Background noise in somebody. Maria, it's you.
Yes, I'm
It is
outside. I
funny,
thought I'll
girl.
read.
So
I'm
funny,
not.
girl.
Maria, mute yourself.
Okay.
Thank you.
Yeah, it's now.
Followed? So this is exactly the plantar fasciitis. It's tight. I will show you an exercise, and this heals. This is the calcaneum, the bone, the heel starts paining. Okay. Now let us understand this also. What exactly is the healthy foot? This is the heel bone, the calcaneum, and this is the fascia which joins like a tree branches, 5 digits. So it has 5 branches of this fascia. It's not a ligament, it's not a cartilage, it's a fascia per se. Now, if it's inflamed at some place because of the earlier causes, the injury, whatever, the tendon is tight, inflamed plantar fascia will show like this. Yeah. And then we may also have a spur which is jutting out, and each time we put our foot on the floor, it will start paining. Plantar fasciitis. Yeah. Followed?
Ma'am, the burning sensation under the metatarsals is what's the reason, ma'am?
Yeah, so madam, the pain can be manifest. It is the same thing, but some people will be having a throbbing pain. Some people will be having a neuralgic pain if the nerve involved is too much, and some people will be having a twitching kind of a pain if a nerve is involved, and some people will be having a raw, sore, bruised pain if the muscle is involved. It just depends on which nerve is pressing. And a burning pain can also be because of a recent inflammation. Right? See now, this fascia has been torn over here. Then also it will be paining here. Okay, not exactly on the heel, but the area of tear. Now this is the spur which has happened. See, and you will be getting pain over here. This is the bony spur. Clear? Right? I think we have one more slide for this. Yes. Now, various other etiologies can be there. What is the meaning of etiology? The causes of pain. Some will be having neurologic. Okay, if you are having some maybe diabetes and your nerve involvement, peripheral neuritis is happening, then also neurologically you can be having this pain. What are rheumatologic causes? What is the meaning of rheumatologic? If you are having
Rheumatoid arthritis.
arthritis, or it can be injury or traumatic. So these causes also need to be considered. Are you keeping your diabetes within check? Right? Are you keeping things in control? So, what are heel spurs? A heel spur is an abnormal calcium deposit on the bottom of the heel bone in the foot, and it is diagnosed with a simple plain X-ray. Heel spur syndrome and plantar fasciitis are the most common causes of heel pain. Two most things, okay? Plantar fasciitis, the fascia, or an overgrowth, heel spur, and can be causing heel pain. 1 out of 10 people suffer from heel spur. Okay, so the statistics is 1 out of 10. More than 90% of the cases can improve without surgery. See, these are very important lines to understand. 1 out of 10 people consider, so it's so common. More than 90% can be improved without surgery. 1 out of 20 people with heel spurs has foot pain. What's the meaning of this? So many people, what's the meaning of this? 1 out of 20 people with heel spurs have foot pain.
The pressure must be on the whole foot.
Read the line again. Read the line again and give me the answer.
Some people can have spurs and they're not affected by them pain-wise, and some have pain.
Excellent. So there are many people who have a heel spur but they don't complain of pain. That's why they say MRIs. I met one ortho, my mom's friend. I called him home once. So he says these MRI guys, no, they exaggerate things on the MRI because technicians do it, no, and the person starts getting scared. Another physio where I take my husband to, he says I don't need your MRI because you earlier, hello Venkatadhari, Srinath Venkatadhari, welcome. He said I don't need it because earlier he must have had a slip disc, a herniated disc that is healed also. I don't need. So people who are chiropractors, they will just do some adjustment looking at the length of your heels. They will make you lie on your belly. They will look at the length, which foot is long, which foot is short. He was trying to teach me also. He realized I'm a doctor. So I too couldn't understand. I was saying this, I was saying the wrong foot. But then he explained to me, he could pick it up fast. They train from these foreign chiropractors. And you know, those, if you see those Instagram handle of those chiropractors, you know what they use this chiropractic on? Not on humans, on lions and tigers and dogs. And the lion also sits very peacefully and gets his neck adjusted. Can you believe it? He showed it to me. Dekho madam, like that. I was wondering how the lion is sitting down. Means the lion is also requiring that. You must see these videos of, you know, the adjustments, and you know, they take it once they do this to you, and then it will be released. It will be released as if you've been waiting for that release. So they don't need diagnosis. So this means that sometimes, you know, these police, porters, their MRIs are bad. First of all, they don't have money, 5,000-7,000 to get it diagnosed. And that is their occupational hazard. They will continue carrying weights because what will he eat? What will he carry back home? What money? Clear? So the MRIs are bad, but they don't complain of pain. But our class of people, little pain, MRI comes, MRI shows everything is normal, but the pain is not going. Very common. Right? So there is not much of a change in the MRI, but the pain refuses to go. Very difficult cases to manage. I told you all, they are hypochondriacs. They come with a shopping bag. Their files are weighing 20 to 25. They do doctor shopping. This is the line. Yeah. So one more line was surgery is considered after around 12 months and the pain doesn't decrease. Do you know these spurs also happen because of what? So suppose there are, see, India is a very carb oriented
Diet.
carb oriented
Diet.
yes, country. Just give me a minute.
Can I ask a question? So
Sure.
if you have surgery on the spurs, can't they come back?
Yes.
Okay. So why do it then?
Yes. So I had a patient also, and when you eat a lot of carbs, okay, what do carbs do? What do carbs do?
They make your blood sugar fluctuate and change your acid in your blood.
Yes. So unless you change this kind of diet, okay. Yes, converted to glucose. Sugar spikes. What I mean is sugar spikes. So you have to understand that if your body is able to manage those sugar spikes, you will not get diseases. Like in a diabetic, now suppose I'm eating a sweet, even my sugar will spike, but my body can manage that, and within an hour's time, it's coming down. That's why 2 hours postprandial, if I check my blood sugars, they will be in normal. I just want to do it. yes, it is a good science in the hands of a trained chiropractor. But Kulwant sir, if there is knee pain, then mostly you need muscle exercises. Sciatica, you need release of that sciatic nerve, which may be due to a thymus muscle, the muscle from where it is coming out, okay, underneath. So there you keep coming. I have classes on sciatica also. I have classes on knee pain. They are hit touch wood. Keep coming for the class. You'll understand. And under a trained doctor, everything is good. But it is, don't expect magic. I go to a chiropractor, he releases me. No, for knee pain, you have to strengthen the muscles around the knee. For sciatica, you have to do the figure of four. You have to do those exercises. Magic cannot be achieved by just visiting a chiropractor. You need to work on your exercises. Exercises strengthen the muscles around the knee. Hope that's helpful.
Doctor, can you put the last slide on? Just now you had put.
I didn't follow.
Can you put the last slide on?
Yes, Srinath.
Yeah.
What class?
Just you had put a slide just a couple of minutes back.
Yes, I will show you the slide. I will show you. This was the slide. Okay, if it doesn't, yeah, so it depends a lot when your body cannot manage that. Like, see, they think that your cholesterol causes heart attack. No, cholesterol is needed. Your body needs cholesterol to prepare hormones. Your liver makes most of the cholesterol because hormones are fat soluble. You need that cholesterol. It is the sugar spikes which the body cannot manage, and then you get a heart attack with sugar spikes. You get other things with sugar spikes. So it is, what is the most biggest culprit is your insulin sensitivity and not cholesterol. Your insulin resistance, insulin sensitivity has to be increased. Okay, it's your insulin resistance which is the culprit.
Ma'am, what about bad cholesterol? Bad cholesterol?
Big topic. LDL, madam, if I start taking it, but
No, does that cause heart attack? Bad
No.
cholesterol and triglycerides.
no, madam. First, manage on the sugars. If your body is able, that is a byproduct. The triglycerides are byproduct. Okay, manage your insulin resistance first, and that the biggest tool is a little bit of fasting. Have your dinners very early. Do your 14 hours every day. That insulin sensitivity increases, everything is sorted. Don't create too many sugar spikes. Don't eat whole day. You can be eating twice or maximum 3 meals in a day.
And ma'am, we hear of some people, like people who have back pain, they go to some person who is an uneducated person and he hits them with an hathoda and they get okay. What is all this?
So madam, they are again chiropractors with that, like Hamare Sindhi mein they say they have that daat, means they can do it. They are also good in their own way. They have that those powers, madam. But haven't you heard that the pain comes back?
Dr. Divya, I have I had around pain in just above my heel, backside. So my uric acid level was high. So I started taking Febustat 40, and then my uric acid came down. And then I had stopped for a week, and then again it had started the pain, but my uric acid was in control.
Yes.
Is it to do with uric acid or something else? Not on the heel.
It definitely has to. See, uric acid also comes as a byproduct of something bad happening in the body. And then you change your diet, you tweak the diet a little bit, and then things are sorted.
Yeah.
Okay.
So is it basically because of uric acid?
Yes, sir. Yes, sir. So again, causes are plantar fasciitis. See, this is the you entered a little late, sir. So we spoke a lot about Achilles tendinosis. This is, I do not, these stress fractures, heel bumps, and bursitis. What is the meaning of bursitis? Anybody? Heel bursitis. So bursas are normal cavities. Okay. So we have smiling Shivani. Welcome. So there are a bursa is a kind of a cavity or a khadda. that also gets inflamed, and then we start getting pain. We have these normal cavities in the whole body. Okay. Let's proceed further. Now, what is the treatment? So there can be NSAID. What is the meaning of non-steroidal anti-inflammatory medications? Okay. So steroidal anti-inflammatory medicines. So sometimes when things don't heal, the doctor takes you to the OT and injects you into the bone. Orthotics means, I'm explaining to you, proper shoes or insoles which can be put in the foot, and then see this so beautifully it's explained. This medial side is protruding down, and the person, what is he experiencing? The alignment is gone. See this COG, center of gravity, which I've taught you all. Stretching exercises, again, controversial. If it's in the initial stage, it will help you. And physical therapy. So let's proceed. Again, this is a slide, again, showing you a different angle of plantar fasciitis. Plantar fasciitis, irritated and inflamed plantar fascia. Okay, we know this, right? Calcaneum is the bone, phalanges are the toes. That. What is this slide trying to tell you? Think and tell me. What is this slide trying to tell you?
Proper shoes.
What is this slide?
Proper shoes.
Flat shoes.
Yes.
Flat.
No.
Heels
Proper
are not. Maybe shoes with an insole.
What else? What angle are you all seeing from? Are you all just seeing the shoes? Aren't you all seeing the bed? That she's descending from the bed.
If the leg is not properly kept on the ground.
No, it's a slide on morning aggravation. Okay, now how do we deal with this morning aggravation is this. Now what are you doing when you are keeping the foot on a block? You are keeping only the toes. The heel is on the floor. You've raised your this thing. What are you doing? Analyze and tell me what is this slide trying to convey.
Stretching the fascia,
Stretching the
whatever you said, that fascia.
fascia.
Plantar fascia.
Yes. Stretching the plantar fascia. And what is going to happen if we stretch the plantar fascia?
The muscles will get some strength probably.
The fascia will get released.
Okay.
The fascia is going to get released. The one which is tight. Okay. Another great way is, I'll just show it to you through my foot. So this is my foot. I'm sorry. This is my big toe. And this is my toe, other toes. So I will be extending all my toes, flexing all my toes, and the gap between these 4 toes, the ball of the big toe and the ball of the little toe, I will be pressing over here. Can you see? But my toes are flexed here. The point, this is very significant. Learn this exercise. Okay, in case you can't press on that space between the ball of the big toe and the 4 toes, you can be using a jimmy or an acupuncture or a pen with a blunt kind of a round thing and press over there. But when you are doing this flexion action of the fascia, you are extending the fascia. And when you are puncturing it with your finger, not actually, but action of that, you are releasing the whole tightness of that fascia. Making sense? Clear? So you can be doing it. It's a good.
So, ma'am, rolling our feet, keeping the bottle, put the leg on that and roll. It also helps, right?
Madam, picture abhi baki hai, 10 minutes for the class to get.
Ball.
5 minutes for the class to get. Picture abhi baki hai.
This is only one part, no 2 part tomorrow.
Madam is impatient, no? She wants to know everything together. Now see this. What is this action?
Pressing the toes with the balls.
Pressing, Nikki?
Those exercises. Stretching the muscles.
What is
Yeah.
the action?
Releasing the fascia.
Rolling the tennis ball in that flat foot point.
Rolling. Pay attention to what I'm asking you all. It's not rolling.
You're pressing the
Extending the
speaker.
metatarsals.
It's extending.
Metatarsals.
Okay. What is the action?
Putting pressure on the point between the two bones that
No.
you showed.
No.
Those points that
Grip.
5 points you said.
It's gripping the ball. It's gripping the ball with your toes.
Gripping the ball.
And what else can you use if you don't have a ball?
A towel.
Excellent. So place the towel. Which towel? Your pota, ghar ka pota, ganda wala. Okay, dried wala. And from one side to the other side, go on doing this. The whole pota or towel will be coming into your grip. Start from one end, go on, go on, go on, go on, go on, go on, go on. Excellent action. You're gripping with your toes. There is exercise of the toes which is happening, and the strength of the toes is increasing. Clear? What are other ways you can be increasing, Kirti madam? You can be placing a towel or something and grip to place in the other second and third grip, third and the fourth grip, or place separate kind of chips of cloth grip. Remember, toes are very important, very, very important. And we use them like mad because we are standing a whole day. Okay, do we give some signals and some instructions to the toes? No, automatically they're done. So you must exercise the toes to get good circulation, to get good blood circulation. Okay, so Lakshmi madam, you're following all these exercises, no? See, this is the towel one. Okay, grip the towel with your soft, the Turkish towel. Now, this is in the center. So this is, I can say, rolling of the ball below the sole of the toe. Okay. Now see, there are different kinds. There's a season ball, and this is a soft ball. This is balancing on the ball. It's not even rolling. So he is gripping onto something. Okay. And this is at the arch of your foot, the curve of the foot. Now, this is excellent exercise. Take a soft ball below your ankles. You know that pad kind of thing on the medial side. That's the below your ankle. It's not at your ankles. And it has to be a soft ball. And what is she doing? She's raising the heels. Once you raise your heels, your calf muscles. See how tight her calf muscles are. How tight. And along with this, she's doing 2 exercises. Then you can be stretching. This is a calf muscle stretch with the wall. This is what I explained to you. Okay, but a finger here. This is again on your stairs. Please do this exercise. See this, up and down on the stairs. This is our Hasta Padangushtasana. She's doing it with the towel. Okay, but doing your toes in. You can also be doing toes out. It's for the ankles, for the hamstrings. And this is again moving of the ball. You can be rolling it for what? Stretching exercises for plantar fasciitis, heel pain, spurs, and arch pain. Then, so these are known as what? These are again, you know, you can be going to the surgical sections where, you know, these are ready-made ones with Velcro, but with a cushion for your heel kind of thing. And you can be wearing your shoes on top. Now there are these orthotics insoles. What is an insole? You can put on your inside your shoe, and it is carved in such a way that there are air pockets. Okay, so these air pockets offer buoyancy. Many shoes which are expensive, you know, they have these air pockets which act like buffers when you're walking. So you need a little bit of a heel. It's not a good idea to be wearing completely flat. A little bit of a heel with an air pocket offers protection to the heel. And there's a cushioning under the sole also. So this is the kind of most shoes with a firm back. Okay, one quick tip is many of us, like my family, also purchases a lot of Skechers. they feel, my friends also, they are doctors, but they don't listen to me. They feel they should take something soft if they have pain in the foot. Is it a good idea? And the shoe fellow at Skechers will do this. Madam, such soft shoes. See, it's bending, and they're very happy.
Something hard.
Family. My shoe is never a Sketcher. My shoe is never that. So go in. I'm not promoting any brand, but go in for some, maybe a solid Asics. Asics is a good brand, which gives you that stiff shoe. Maybe a Nike, okay, which gives you a stiffness, because if your foot is crooked, the sole of that foot of that Skechers will also become crooked. It will take the shape like water. It will take the shape of the container. And haven't you seen some people walk like this? The shoe also becomes like this. Shoe is for support. Don't need that softness. Okay, yeah. So we come to the summary. Plantar fasciitis and tendo Achilles learning we did. Morning stiffness and heel pain aggravation. I showed you quick exercise. Calcanean spurs, very common. Walk on your diet also. And we spoke a lot about orthotics. And today, it's a good idea to be investing in your footwear. If you will not believe it, my slipper is also for 4,500. You will say, what a dirty looking slipper. But after that, I do not have knee pains. It's worth it. And it goes on for 1 or 2 years. I wet it, I go to the washroom, gila ho jata hai kaam mein, but it's a good idea to be spending on good footwear.
What brand is the slipper?
AXIGN.
IGA.
You can Google it, Exit.
Which slipper are you talking about, ma'am? Which slipper? I didn't get it. Which slipper?
It's not very great looking.
Brand you tell.
AXIGN. It's not a good idea to be going in for Dr. Soles also. I have worn those. If we are heavy, it cracks. It sinks inside. Those Bata ka Dr. Soles, naturalizers, all that curve. It's again soft. Please understand, too soft will not do good to you. You need a little firmness. And you need a little heel also in the slipper. So I don't invest on other things, but my footwear is always expensive. Always. Maybe because my father was that way. That time he used to make me never wear 2 patti ka chand. He used to say that's bad. Always wear anguta patti. As a child, I had the worst looking slippers, but my feet are good now. I remember my father. Invest good in good footwear. I used to not have 10 because I was growing very tall. But a good quality Bata he used to make me wear. But not 2 patti which other children used to wear, that white and blue chappal, no. He said that is going to spoil the shape of your foot. Never I had those 2 patti slippers of Bata. Sandals. Sandak it's no. So always invest in a good footwear. Could you please AXIGN? AXIGN. Google it. It's recommended by these are doctors only for the foot. So in fact, you can be getting it cheaper because I got it from her. So maybe I spent 1K more. Okay. So we meet after 3rd November. Long chutti I'm taking. I'm going somewhere alone. Okay. And thank you for the gift of your time, energy, and attention. And happy Diwali to all of y'all.
Happy Diwali, madam.
Thank you. Have a great time. Thank you. Wish you all a very happy Diwali.
Wish you the same. Thank you, Tina.
Happy Diwali to you.
Yes, ma'am. Yes. Bye-bye.